In a world where one woman tries to start a podcast,
How will I ever do this on my own?
she thought she would have to get expensive equipment.
What? I can do all of this on a free app?
She thought she would have to find creation tools all over the internet.
You mean it can all be contained in an app on my phone and computer?
She thought she would have to do all her own distribution.
You mean to tell me this app is going to send it to Spotify, Apple Podcasts, Google Podcasts, and all those other platforms for me?
She thought she would never make any money.
I don't have to wait for a minimum listenership to monetize?
She thought that she would have to find all kinds of different equipment and pieces.
But I'm going to download this free Anchor app and get started today.
Visit anchor.fm and download the free Anchor app to be just like her, the ultimate podcaster.
Hello and welcome to the Lou Review. This is your host, Rosa, and today I have a special guest, Terri Paige. Thank you for being here.
Thanks for having me. It's exciting to be with you today.
Yeah, so we've met several times at your Medical Transformation Center here in Louisville. Can you tell us what the Medical Transformation Center is?
Oh, sure. I'd be happy to. So the Medical Transformation Center it's a place that was born out of a lot of perceived need that we saw with over almost 30 years in the primary care world. But basically what it is, it's a place where people can go and take advantage of a multitude of resources and training that we have amassed over these many years. So we can offer what you would consider the traditional medicine paradigm, so allopathic medicine, but we also can layer in our training in genetics, in nutrition and metabolic medicine, in cellular medicine, really digging down to the cellular level and trying to understand where the malfunction is. We do a lot with the endocrine system. We work with folks that have, hormone issues, thyroid issues, things like that. If we see kids in the practice. We see kids that we never see a well child, unfortunately, at MTC, but actually we love to be able to help. When we see a kid, we're very hopeful that we can help. And when we see children in MTC, they maybe they have a diagnosis that their parents really aren't willing to accept the prescribed path for, for example, ADD, ADHD, or autism. Parents are looking to understand what they could do maybe to get that little body to heal itself or to have a better outcome rather than only take prescription meds if that's, the answer they've been given. Really dig down into the underlying reasons or allergies or stomach issues, things like that we can help really have best quality of life and outcome. Same for adults. A lot of times people come to us and they've been everywhere and they haven't gotten answers. And we just love to, be helpful in that regard. I guess we offer people hope.
Yeah, definitely. When I went for your opening, you had some really interesting different rooms that did different things. There was like an infusion center, correct? And then there was a machine that will help do Kegels for you. You still have that, right?
About that, yes.
And I was really impressed by how the amount of time that all your providers dedicate to meeting a patient and really getting their full history and getting to know them. Do you take any insurances there? Any medical insurance?
We're a bit of a hybrid in that we can take a flex spending or a health savings account for our provider services. So if you see one of our physicians or our physician or nurse practitioners, or if you do any, regenerative therapies through us or any treatments, protocols through there, we can absolutely use your flex spending or health savings. We utilize your insurance benefits for the diagnostics that we do. So, for example, we have National Lab in our office that does all of our lab draws. And so that lab will bill insurance and do all the coding. Same thing for if we want an image or a sleep study or anything like that. So, we don't bill code or collect insurance for our services because we have found that it gives us the latitude to be able to use a variety of tools, all of our tools that we, because people come to us free will, right? They haven't been told they need to come to us by an insurance provider. And two, like anything, when you have skin in the game, you're more invested in it. And, because really anybody that we work with at MTC, it has to be a partnership. What we do won't work if there's not, we're working together. It's not just, I've got fairy dust here. So
right, we're not focusing on the placebo effect. We're just
throwing
a pill
we're
at it.
using evidence-based strategies that maybe just haven't made it to the mainstream clinic yet.
Sure.
Yeah.
So your providers there include your husband, who's a physician, and is it 3 nurse practitioners? Is that right?
Right now we have 2 nurse practitioners, but you're
practitioners.
right, I'm on the hunt.
Oh,
so
okay.
I am on the hunt. We anticipate, so we have my husband, Dr. Carl Paige, he originally trained internal medicine and pediatrics, did his residency at UVL, double boarded, and then he practiced in that regard. We had a traditional insurance-based practice out in Oldham County from 92, and, really he practiced that until 2017.
Okay.
And then we have 1 full-time nurse practitioner and 1 part-time nurse practitioner, and we're tracking to need another one by the summertime.
Okay.
Yeah. And ultimately another physician.
Fantastic. And what's your role there, Terri?
So officially, I guess my title is CEO. So the buck stops with me.
Ooh, you're that administrator. Okay.
Well, it's more than that. I'm a certified lifestyle coach, and I'm a certified professional coach too. And I love that role too. I love being able to utilize that. And this year, actually, I'm going to get to use that a little bit more in some formalized programs that we're implementing, which is exciting.
Yeah.
And two, it's just such a helpful, that training that I went through is just really helpful in working with people and meeting them where they are and helping to create change, co-create change together. So that's really helpful. So, I guess if you were going to look at an org chart, I have pretty much everything comes up to me, and then my husband is chief medical officer, so he's responsible for making sure that the medical side, the clinical side, the team is well trained, and he's overseeing all of that type of thing. But ultimately, the running of the business and the growth is my responsibility.
Okay. Well, it sounds like you guys are a power team. So what in your experience together led you to make this change from that primary care practice to creating this new model?
Well, excuse me, there were several factors to that. We grew up together in the same small town. I grew up in a medical family. My husband, his father was very sick in the VA hospital system, so he grew up observing as a child and was just fascinated with all of that, the figuring it out and the puzzle pieces and how it all worked together. And I worked in my dad's office a lot, and I loved that piece, but unfortunately he had me starting really young, and when he exposed me to the actual hands-on blood and guts stuff, it was too young, and I really was just like, okay, I love this world, I love interacting with patients, I love helping, but I don't want to see blood and guts, so it kept me out of the clinical side. Yeah. But I love that world. I love health care. So, it was always our dream, and when he finished medical school and residency, to go someplace in a town that was maybe a little smaller, but nearer a big city, so that we could have access to the things we'd become accustomed to. We grew up in a really small town in Western Kentucky, so we wanted to stay kind of this side of the state. And just hang the shingle. Hang the shingle, run this, I'm going to say a little bit more specialized, because he's
practice.
internal medicine and pediatrics. And so we looked around, and then we realized, this is in our own backyard. Oldham County has a need.
Okay.
And so it was 1992, and there had never been a full-time board-certified pediatrician out in Oldham County up to that point, a full-time one.
Really? Wow.
Yeah. And so there was a need there. And so we went out there and we hung the shingle, opened up shop, painted the office, set it all up, decorated it, the whole 9 yards.
That reminds me of Dr. Quinn, Medicine Woman, when she's
It was
hanging that
so
shingle
much fun.
up.
It was so much fun because, then my job, and I'm originally an accountant. That was what I did when I went to school, UK, school, business school. And so I had worked as a corporate accountant. So I had that managerial and corporate accounting background and understood finances and that kind of thing, which was helpful, to run a business.
Yes.
So when he finished residency, we went out there and we started. And it was just, me and him and a nurse. And it was great, you know, and it was so simple back then, right? Because, you know, if you did some insurance billing, but it was the old HCFA forms on a dot matrix printer. I mean, this is old
literally
stuff.
never
I know. You don't even
seen
know
that.
what I'm talking about.
Wow.
But, you know, I mean, but it was much more simple, my point. You know, you could run a primary care office with 3 people very easily, a busy one, you know. But, of course, it wasn't busy at the beginning. He actually would go fishing during the day.
Okay.
And we'd call him and say, we have somebody, you know, kind of like on Ghostbusters, you know, we got one.
Yeah. We caught a patient while you were fishing.
But it didn't take long because we grew on the peds, and that's how we marketed it. We grew on the peds. But
people
then,
will stall on going to the doctor for themselves, but they'll take their kids.
Yeah, and people were so excited that there was somebody that was there that they could access all the time, you know? And that was great. And then once Mom and Dad and Grandma and Grandpa realized, oh, you're an internist too? So then it just grew. So before, you know, within that first year, we had hired another physician. We were looking for a building. We ended up building out there and having a team of 4 physicians and a large practice. And then, you know, about 10 years later, that practice split up and we went up to LaGrange. And ultimately, I mean, the practice that we ended with had over 10,000 patients and multiple providers. It was one of the biggest ones in the area. But you know, I mean, back in 2008, things changed. You know, of course, we had the big recession, but then we also had healthcare reform.
Yes.
And healthcare reform in concept was lovely, you know, to you know, you want people to have access, you want people to have care. But unfortunately, there were also a lot of fallout from that with the changes and how it affected the folks on the ground, particularly primary care clinics.
Private practice.
Yes, and private practices, you know, just the administrative burden, the electronic health records, the, you know, all of the things, I'm going to call it red tape, you know, the red tape. So, you know, you're adding staff just to
handle the red tape.
You can't really focus on patient care. And we did it, and we played the game really well, but it got more and more demoralizing, you know, because you just felt like, gosh, you know, we used to be able to take care of 50 people in a day. Now we can take care of 20 because drop down, click, right? You know, which I know now EHR is just common, but, you know, many years ago it wasn't, and it was really a workflow issue and, you know, a lot of other things with that. But also we just started to feel like, you know, there was a better way to take care of people. You know, it kind of started with, as we were getting a little bit older, we were all kind of growing up together, and people started asking us about, you know, menopause and andropause, and they wanted to know about, you know, hormone replacement and things like that. And, you know, we really didn't want to just go down the standard path. We wanted to do things that were responsible and helped people stay well, right? So my husband went to learn about bioidenticals, and then that opened up a whole field of just that. You know, now it's so much more commonplace, but back in 2010, 2011, it was still a little bit weird, you know.
This is bioidentical hormones.
So bioidentical hormones was that original gateway. And then what we realized was there was a whole world of genetics, right? You know, looking at, you know, SNPs and predispositions and epigenetics and all of those things. Those are more commonplace words today. But back then, those were like on the edge. You know, those were edgy words, you know. But that's those. So we got in with an organization, the American Academy. Back then it was called the American Academy of Anti-Aging, Regenerative, and Functional Medicine. And that was the thrust of it. You know, it was really taking things to the clinic now that were in research, that were evidence-based. They just hadn't gone through, you know, all of the other regular channels yet, but there was good science behind them. So we started, you know, getting into that. I'm going to say, you know, a lot of it was my own personal health issues. I had a lot of autoimmune disease and some different things like that were fallout of, that's just a whole other story. I had a lot of issues health-wise, and we were looking for answers for me too. And
so as you found answers for you, then you were like, we want to pass these on to the community and let them benefit as well.
You know, so things just like, you know, GI health, right? Again, common now. Everybody knows, oh, leaky gut, right? But 12 years, 13, 14 years ago, not so much. But just different things like that. So we thought, you know, my husband got trained. He got board certified by this organization, did his fellowship, his advanced fellowship through there. And then that's when I did my lifestyle coaching certification to help our patients through that journey. And we really started to focus more on wellness in our insurance-based primary care. And we really thought we'd have some partnership maybe with some of the insurance companies or that type of thing, but it was a little bit before its time, before patient-centered medical home really hit its stride, and with some other things now that are in place. And it just got more frustrating, more and more frustrating, because we would want to focus on, going upstream and figuring out why you had high blood pressure, why you had diabetes, what we could do now to preempt, maybe if you were pre-diabetic, to preempt it from happening. But it just seemed like we were caught in that cycle of, that algorithm of if it's the symptom, then it's this diagnosis, then it's this medication, rather than really work on helping people well. So we stayed that way for a while, but then, what is that called? Cognitive dissonance, right? When there's a better way, and you just really can't stomach the idea of just following the established protocols. And so that's really actually long way around the circle there to tell you that, but that's what led to Medical Transformation Center. We had hoped to be able to put those principles into our insurance-based practice, back to your question earlier, and let people take advantage of their insurance benefits and so forth. But there was so much frustration and red tape to try to even do that. Plus, not everybody's into it, and if they're not, then, it's, again, then that's what created that cognitive dissonance when they were just like, just give me my pill, doc. And you're like, no, but you really could do something else,
Yeah.
So
you could have integrity to do what you believed was better and right.
Yeah, and the good news is, based on results,
yes,
people, improved. They got well, or their life trajectory turned. And it used to be in the beginning of Medical Transformation Center, before we had a real phone. I had a Google Voice number. We had a Google Voice, and so everything came to my cell phone. And I would just answer it literally wherever I was, because we started out kind of part-time as we transitioned from insurance-based care over.
Yeah.
And I will tell you, to this day, it's still my favorite thing to answer the phone. And the girls in the office now, whose job it is to answer the phone, they're like, oh, God, she's on the phone. Because, it's such a lovely spot. You get to hear somebody's story. And the best thing you can say, in my opinion, to them, and, again, you can hear the sigh on their side, too, is, you know what, we've seen that before. You're not crazy. You're not weird. I think maybe we can help you.
Right. And I really appreciate your willingness to listen to people who other people will not even give them an appointment because they might have something they don't want to talk about. And I've seen that happen. And so I really appreciate what you're doing and making that option available for people. So what can the Louisville community look for that's new and on the cutting edge for the Medical Transformation Center? Do you have anything coming down the pike?
There are a few things that we're excited about. What we are, I guess, known for. What we're known for is just kind of, first of all, just kind of being out there, for one thing, being out there on that edge, but, really looking for ways to help people optimize. And one of those things that we've realized there's such a need for is, regarding fertility. There's such a need for a variety of reasons. For a variety of reasons, we're seeing more and more fertility concerns. Some of it's maybe, age-related, maybe by waiting, until, people are established, etc. There's also, though, environmental issues, environmental toxins, things like that are disrupting the endocrine system. There's a lot of reasons that's occurring for men and women. And so we've, in the last, 18 months or so, really realized, that we're hearing that a lot. And we do have tools to be helpful with that. So we're putting together a little bit more of an, I'm going to say more of a protocol to really work with people in that way,
great.
And really dig down into that. So that's one thing, the other, metabolic health, well, that's a perennial for us, metabolic health in general.
For sure.
And then cognition. Cognition, same thing. Again, for a variety of reasons, right? So, there's... there's the demographics, right?
Are you talking about memory and dementia?
Memory and dementia, brain function, yes. Cognition, yeah. So, in terms of...
But, there are lots of things that can
right. So
cause people to have
multifactorial.
cognitive
Right.
deficits, right? A stroke can cause cognitive deficits.
Yeah, exactly. But
Yeah.
I guess, what we're seeing, too, though, first of all, there's just demographics, right?
Yeah.
Baby boomers are getting older.
True.
And, just there's that component.
Okay.
But then there's also, we have seen, a lot of post-COVID cognition issues too.
Brain fog,
that type of thing. So, it's again, to have some tools to be able to help people, that's gonna, we've just noticed that there's a need for that too. And so those, we're kind of amassing our toolkit there as well.
So how does someone reach you to set an appointment to find out if there's something you can help them with at the Medical Transformation Center?
Well, our website is updated, which is so exciting.
Great.
It's been a while.
I
We've
love
been working
up-to-date
on that.
websites.
We've been working on that. So medicaltransformationcenter.com.
Okay.
And there's a lot of information on there, which, I'm proud to say now it's accurate.
Yes.
It had a lot of old information, and we've just been
I get
working
that.
over the past 18 months to bring it up to snuff. And so I can tell you it's accurate. It's actually getting ready. It's in the process of getting now to just like a cosmetic facelift, but the information is accurate.
That's what we need.
And there's a contact form in there, or
Okay,
you can just
great.
give us a call at 502-443-9962.
Fantastic. Well, thank you, Miss Terri Paige, for sharing about this, and I hope it's able to help some people, and I appreciate all the good I've seen it do already. So,
Well, thank you for
All right.
having me.
and we will see you in the next episode. If you've not already, subscribe to the Lou Review podcast so you'll be notified for the next episode, and I'll see you there.